The Mesa Chamber of Commerce Inside Business Podcast brings you a unique view of Mesa through its vibrant business community and the subjects that are important. The podcast is produced in the Mesa Chamber of Commerce Media Studio. Our podcast is hosted by Mesa Chamber of Commerce CEO Sally Harrison. Please enjoy this episode of the Mesa Chamber Inside Business Podcast.
Hi, everybody. This is Jeff Baer from Baer Media Group, and I'm absolutely thrilled to be here today with two outstanding guests. And we are here because May is Mental Health Awareness Month, and the Mesa Chamber Healthcare Committee is promoting these great podcasts of all kinds of partners that are trying to do good stuff in the community. Today we have Monica Coury, who's the Vice President of External Affairs, Arizona Complete Health, and Daniel Openden, President and CEO of Southwe Autism Research and Resource Center. So to begin, why don't you, Monica, start, ladies first, tell us about yourself and the organization you represent.
Absolutely, Jeff. Thanks for having us, and big thanks to the Mesa Chamber for hosting these podcasts. They're really important. Arizona Complete Health is a healthcare organization that provides comprehensive services to over 600,000 Arizonans across the entire state who are enrolled in Access, which is Arizona's Medicaid program, or the Health Insurance Marketplace, which is sometimes known as healthcare.gov, and also for Medicare Advantage. So we cover everybody from birth to seniors, and we do a lot of work specifically around members who have complex care needs, including individuals with serious mental illness across the state and other complex needs.
Excellent. Daniel, your turn.
All right. SARC, or Southwest Autism Research and Resource Center, we have a very big vision of what we want the world to look like, and that is people with autism meaningfully integrated into inclusive communities. And we do that by advancing research and providing a lifetime of support for individuals with autism and their families. I always like to tell people there's sort of these three major buckets at SARC, right? One is research. Is how we started. We were actually only had one R in our name when we began, Southwest Autism Research Center, and we continue to have research be at the sort of core of what we do across everything that we do. And then services across the lifespan. I think one of the things that makes SARC unique is that we provide services for little kids and bigger kids and teenagers and adults, not just the little kids, which is where I think most people like to focus. And then the final one is that we're very invested in building these inclusive, supportive communities. We often think of that area of us. We often say that we are as committed to improving and changing the behaviors of people with autism as we are to improving the behaviors and skills of the communities in which they live. And so we're thrilled to do that. And what's most exciting for us is last January, we opened our 5th campus in East Mesa. It's been open now a little over a year, almost a year and a half. And we are just thrilled to be in Mesa. We're seeing a great demand for our services and an amazing community for us to be working in.
Whereabouts in East Mesa is it?
So we're at Power and McKellips. Okay. There's a new Canes there, and we're behind the Canes, which is great because when you go out onto our playground, you get the nice whiff of fried chicken when you go outside, and it's Raising Canes.
Can't beat that.
Can't beat that. Yeah.
The secret sauce come with it?
Sometimes, I don't know.
Well, as we mentioned earlier, May is Mental Health Awareness Month, so we'd be interested in knowing what your organizations do in terms of helping your members in terms of mental health awareness, behavioral health needs, all that good stuff. Monica?
Yeah, absolutely. And I think Danny touched on a really important word, and that's inclusivity. We often don't think about that in terms of healthcare. But the real issue that is important about Mental Health Awareness Month, and April was Autism Awareness Month, these awareness months really drive towards educating all of us around signs and symptoms, as well as how to be a supportive parent, caregiver, family member, friend, neighbor, when you see somebody who may need or some special supports or may have some special health care issues. So really what we try to do is provide that education and awareness as well as the actual services. Sometimes we ignore signs and symptoms. Sometimes we think that, and Danny can talk about it on the autism side specifically, sometimes we think our little one's going to grow out of these things. Frankly, sometimes our own pediatricians tell us that. And we do the same thing as we get older too, with signs and symptoms around depression, anxiety, suicidal ideation, all these kinds of things that occur on a day-to-day basis. So what we're seeing is a huge demand now as we're pushing out more and more information and education to help people understand and reduce the stigma around actually accessing services, which is a huge barrier actually to getting care. So that is one of our big focuses for Arizona Complete Health. And actually for us, we are very focused around mental health because we serve as the Regional Behavioral Health Authority for Northern and Southern Arizona. We run the crisis system. We've done a lot of different kinds of programs around justice-involved individuals where there's a co-occurring mental health issue that has cycled somebody in and out of jail, for example, when they haven't been able to access consistent treatment. We've also done a lot of work with first responders in terms of training and mental health first aid, as well as in schools to support teachers and administrators in seeing signs and symptoms so that they can call the crisis line and reach out and get support and services for the kids in their school or law enforcement who might have to do a special different type of drop off so that we can move people into treatment instead of into jail. So those are some of the kind of high level things that we're working towards.
Daniel?
Yeah, I mean, our focus is entirely on people with autism in the communities in which they live in, right? So for us, the biggest area that we're doing that, we're focusing is just on the services across the lifespan. One of the sort of core programs for us in which we're scaling really all over the state is an inclusive preschool program that integrates kids with autism with their typically developing peers. So imagine a preschool where half the kids in the class have autism and half or more do not. And the purpose for this, really at the core of what autism is a social disorder. So it never made that much sense to us to put kids with autism only with other kids with autism. They need to be around sort of social experts, and social experts are kids without autism. And so we integrate those kids with autism with the typically developing kids. It creates an incredible win-win because the majority of our kids with autism will sort of graduate from our preschool and go on to general education kindergarten. The typically developing kids get to be in a very language-enriched environment, which is important from any early childhood expert will tell you. They also are learning everything around inclusion and acceptance and tolerance and just being around people who are different than them. And they get the benefits of one teacher for every 3 to 4 kids in a classroom, which you would never see in a regular preschool. So that's a big thing that we do, and you know, we're really excited with the Mesa campus. We are about 1.5 to 2 years ahead of schedule in getting all of those classrooms open. We'll open our 4th and final classroom in July, August of this year. And there's been a great demand for that. So we're excited about those preschools. And then we provide services, we call it we just rebranded it. It's now called AIM ABA. AIM stands for Achieving Independence Meaningfully. And this is our home, school, and community-based services where we are in people's homes, providing services and supporting their homes. We're in schools, helping to integrate them into their schools. And then we're out in the community. So I've got therapists every day that are at T-ball or Little League, or they're at dance class, or they're at volleyball classes, again, trying to find ways to integrate our kids into the community. We run teen programs that partner with other nonprofits where we provide volunteer service hours for kids with autism and then teens that are typically developing, again, integrating them there as well. And then finally, for our adults with autism, a big focus for us is around employment because that's a path to living independently. We have a really innovative and unique program in partnership with our sister nonprofit called First Place, which is the First Place Transition Academy. And this is a 2-year intensive program that helps young adults with autism learn how to live independently. And the goal is by the time they graduate in those 2 years, they're able to move out and into any apartment of their choosing, whether that is a place near mom and dad so they can be close to family, or a place near their job so it's easy for them to get there. The choices should be bountiful for them if we've done our job right and giving them the skills to be able to live on their own.
That's terrific. Monica, I have actually two questions for you. The first one is, you had mentioned the REBA earlier. I think it would be good if you could just give a little background on what that is and maybe how that all plays into this. And then when you're done with that, if you have enough time left here, which I think we do, talk about the biggest misconception people have about accessing mental health care depending on their coverage, whether it's Medicaid, Marketplace, commercial, whatever.
Yeah,
So
absolutely.
the REBA thing might be good to give people a baseline.
Absolutely. Yeah, the REBA is, I mentioned it earlier, spelling it out, which is the Regional Behavioral Health Authority, but we all, and you having the healthcare background as well, we all lovingly refer to it as REBA because we can't get enough acronyms in our healthcare world. So let's just keep throwing more at us, right? So yes, we are the REBA for Northern and Southern Arizona. And Mercy Care Plan is the REBA for Central Arizona. And so being a REBA essentially means that we are designated as the access health plan for individuals with serious mental illness. And that includes individuals enrolled in access as well as individuals who don't qualify for access but have been certified as having a serious mental illness. Serious mental illness includes diagnoses like bipolar disorder, schizoaffective disorder, schizophrenia, and things like this. So it really is people who are challenged with some serious mental health concerns. And so we design programming all around that and work very closely with our provider partners across the state to provide services to those individuals. And I think one of the big misconceptions that people have is that they're not sure they even need to get services. And then when they wait and wait and wait, they wait until it's a crisis situation. And then you're talking about dialing 988 or one of the crisis lines for your health plan or something like that. So what we want to do is try to get people to be more aware of signs and symptoms earlier on of depression, of anxiety. And I think sometimes people also are just afraid to take that first step because we talked about the stigma issue being very, very serious. And that's really a lot of times a cultural issue. Sometimes it's a family dynamic. Sometimes it's a religious issue where there are communities that feel, I don't want to go and tell some stranger my problems. And really, mental health treatment and services is not about that. It's about how do I manage the symptoms I'm experiencing? How can I live a quality life and get the help that I need to be at my best? So that's one of the things that we strive to do. And one of the other sticking points that I would say that I just want to make sure people are aware of is finding the right provider. You don't have to stick with somebody that you don't feel comfortable with. Sometimes you get in there, this is a very personal service. You get in there and you are one-on-one with a psychiatrist, psychologist, a licensed master's in social work or something like that. And, maybe you haven't established that rapport. You can look for a different provider. And that's what your health plan is there for. So sometimes I think people start picking up their directory and pulling out names and calling around. But you don't have to do all that work. I think that a lot of times people, for whatever reason, hesitate to flip over their member ID card and call that customer service line. And that's what plans like Arizona Complete Health are here for, because we have an entire member services unit. All you have to do is call and say, hey, I started to look in your online directory. It feels overwhelming, because it is. We have thousands of providers on the directory, and it can be kind of tricky to navigate those online directories, if I'm being really honest. So truly, don't spend a lot of time doing that. Just pick up the phone and call member services and say, hey, I really need help. I need to see a mental health provider. Here's my symptoms that I'm experiencing. Can you help direct me? And there will be somebody who will do that for you. And whether that's with Arizona Complete Health or your employer plan, your employer-sponsored plan, or another access plan, whatever it is, all health plans have those phone numbers and have that assistance available.
That's terrific. Daniel, let's jump to you for a second here. Where do you think the system breaks down for families trying to access behavioral health care, and what does success actually look like?
Yeah, so I think the biggest area where we see that breakdown in terms of access to care is really at the diagnostic level. We know in autism, we argue about lots of different things because largely there's so much unknown about autism. But the one area that everybody uniformly agrees upon, no argument whatsoever, is the importance of early identification and early intervention. Early intervention is where we get the best outcomes. You can't start early intervention if you're not identified early. And so we did a study, it was a 5-year study of the National Institute of Mental Health, where we did a triple screen with pediatricians at well baby exam visits, for example. And that just meant that every baby that was coming in for a well visit was screened for autism at 12 months, 18 months, and 24 months. And at any time that they were identified with autism, they were sent to SARC for a free diagnostic evaluation paid for by the NIH grant. And when we did that triple screening across 110 pediatricians across the valley, we lowered the average age of diagnosis for the kids in that study. In Arizona, the average age of diagnosis is almost 5 years old. In that study, the average age of diagnosis for kids was 22 months old, giving those kids about 3 more years of treatment and then maximizing the potential of early intervention. And so we know that that's possible. That grant ended, and so we don't have 110 pediatricians screening anymore. So one thing is, screening for autism, I think, is incredibly important. I think we need to have pediatricians doing that on a regular basis. I think the challenge for why maybe pediatricians have stopped doing that is because if there is a flag for autism, then you got to send somebody in for a diagnostic evaluation. You're going to be met oftentimes with wait lists. You're going to be met with high costs. You're going to be met with challenges getting an authorization for services. All of those are barriers to access to treatment. And so in 2025, SARC actually started raising philanthropic dollars to make access to diagnosis free for everyone. And the idea was we wanted to get rid of the wait list. We wanted to get rid of all the insurance authorization barriers. We wanted to get rid of the financial barriers and just get people access to diagnosis so they can get started in treatment. And so I think that solves a lot of problems for us and really for our community. We're seeing more and more families be able to come in and within a couple of months being able to access that diagnosis and get right into treatment. I think that those end up being those biggest barriers for us. A lot of times the systems that we have set up are not designed for efficient diagnosis. There are just lots of barriers everywhere you go to be able that sort of delay that. And by making them free and quick and easy, still reliable, right? We still ensure we have the right people making the diagnosis, but families can access treatment much easier that way.
All right, let's dial down into autism a little bit. A big part of the mental health and behavioral health conversation is autism spectrum disorder, ASD, and applied behavioral analysis, ABA, and Medicaid. So let's start with, can you explain for the listeners what ASD is and what ABA is? Monica, let's start with you.
I feel like we should start with the expert.
Okay. Oh, sure. We can jump back to Danny.
I can do the layman's terms,
sure.
but I'd rather kick it to Danny for the opener on this
let's
one.
Do that,
he's
the
doctor.
Sounds good. Well, so I'll start with autism spectrum disorder. So to me, at the heart of what autism is a social disorder. It's diagnosed because you have a combination of traits, usually some deficits in language or communication, others in social interaction and social skills, and then something we call perseverative or perseverative interests or obsessions. So this can be anything from kids who rock back and forth to flap their hands. For other kids, they have real intense interest, or they like to line things up a certain way, or they really only like white foods. I mean, there's a whole bunch of them. And maybe the most important thing to know about autism, other than at the heart of what it is a social disorder that's impairing social interaction and communication and leading to these sort of behavioral deficits, is that it is absolutely a spectrum. We say all the time, if you've met one person with autism, you've met one person with autism. The individual variability across the population is huge. And while that makes it very, very complicated, I actually think it makes it the most fun part of the work that we get to do. Because no two kids, no two teens, no two adults look exactly the same. It becomes on us to figure out how to individualize treatment to meet the unique needs and challenges of the people that we serve. And then ABA stands for Applied Behavior Analysis. It is considered to be the gold standard treatment in autism. It has more scientific data and research behind it than everything else. And yet I will be the first to tell you that ABA is not a treatment for autism. By definition, it is a scientific approach for improving socially important behaviors. And under the umbrella of ABA are a number of evidence-based treatments that have been used and shown to be effective for working with children, teens, and adults with autism. At the end of the day, what ABA is really trying to do is look at the environment and figure out how we modify, change, or improve behaviors so that the people that we work with learn the skills they need to be able to navigate our community and live as independently as possible.
Do you have anything? That was pretty good, Dan. Okay. Pretty solid.
I know,
as a
right?
layperson.
Well, he's just got a PhD for a reason, doesn't he? I mean, only thing I would add on to is really the emphasis on what Danny talked about, that autism is a spectrum. And the response has to be individualized. So it really changes depending on the individual circumstance of that child or person. And the other thing that I would just add on to is it's not like it goes away. It's something that you live with for your whole life. So we focus a lot on the kids. But what Danny is doing and what SARC is doing and what cities like Mesa are doing and Mesa Chamber and other employers out there is they're looking at the continuum of that individual's life, because once they get out of school, how can we have them employed? How can we have individuals be productive members of our society? How can we have inclusive communities that welcomes individuals as adults living with autism? So that's really another big part of what this is about, because I think a lot of times we think of autism and we think of little children, but really it's a lifelong issue.
And I'll just add to that too, Monica. I mean, I love from your perspective this emphasis on the spectrum and the individual differences. And this is, by the way, why ABA in so many ways is a great fit for people with autism, because a core tenet of ABA is individualization. It is not a one size fits all. I am one of these sort of people that think that like ABA can change the world, and I firmly believe that. But when we're talking about people with autism, it make a huge difference, not because it is a one thing for every child with autism, but because it is flexible enough to be highly individualized to meet the unique needs of each individual person with autism. And that's why I think it's a good fit.
So how does someone obtain a diagnosis for ASD or ABA services?
Yeah, so the kind of like what I just said, what I said earlier, I mean, I think that the majority of people raise concerns with their pediatrician. What we saw for many years is pediatricians kind of talk parents off the ledge a little bit and say, well, he's a boy and let's just wait and see, and maybe he'll start talking later. And we know now that that's exactly what we don't want to do, right? If there is a concern, we want kids screened and evaluated as quickly as possible, because the clock is ticking and we want to maximize the opportunity and the window for early intervention wherever we can. That's why that screening project I talked about earlier I thought was so great, because it didn't rely on the pediatricians or the parents to say anything. And then, from there, pediatricians typically aren't the ones that can make a diagnosis. They will refer most often to psychologists, psychiatrists, or developmental pediatricians who are licensed and make sure it's within their scope of practice to be able to make an evaluation for autism. And then, like I said, there are some challenges that you'll come across in terms of wait list or insurance authorization, and we're trying to solve all those problems now, but that's typically the sort of a process that you'll go through. We've also done some really innovative work. We were the first to use telemedicine for diagnostic purposes as well. And pre-pandemic, like, we had this great tool and technology and no one would use it. And then, the pandemic happened and all of a sudden nobody could get in to get a diagnosis anywhere. And our use of that technology took off. And today, we're doing probably 80 to 90% of our diagnostic evaluations right in the comfort of the own home of the family. We just had a family recently come to us and say she went to get a diagnosis, and the child was so clung to her, her daughter wouldn't leave her side. And so the psychologist said, I can't evaluate her. And so she called us like, is there any way you can do it in the home where she's comfortable? And I go, well, that's all we do. And she was like, I couldn't believe that she could do this in her home, that she could access it for free, and that she could be not have to wait so long to get that diagnosis.
That almost goes to the next question, which is, how has this all evolved in the last 3 to 5 years? How has the demand for services evolved, and then how do you get those services?
You probably know the data better than I do from what you're seeing at the health plan level.
Well, you can talk about the incidence and prevalence, but it's just skyrocketed. Because we have all been committed to that goal of earlier diagnosis. And one of the things that Danny talked about is the role of the parents, because it is so common to walk into your pediatrician and explain what you're seeing with your child, and the pediatrician essentially says, let's wait it out. And that kind of training, I just encourage parents listening out there to really not accept that as the end of the discussion. Sometimes you have to push a little bit. Sometimes you have to be your child's own advocate and press that a little bit further. But the demand has really increased, and we've seen it just in my own health plan. We're seeing it across the country with rising costs, which lead to a bunch of other things in the broader system, which we can talk about later. But absolutely, we've pushed to get more information, more education, and more awareness out there to get people into services, to get that diagnosis and start services sooner.
So you get more people to come in to get the diagnosis. So how does your workforce grow? What kind of challenges does that present?
Yeah, I mean, it's interesting. We have people that are new employees at SARC every 2 weeks, and they're every 2 weeks welcoming new employees in. And one of the things that I share with them is that, technology, AI is going to replace a lot of jobs. But I firmly believe that because at the core of what autism is a social disorder, the only way we're going to be able to help more people with autism is to hire more people to work with people with autism. And so there are workforce challenges in that regard. We are always in a constant state of hiring. One of the things we're really proud, we know that compared to what we see nationally in autism service providers, our voluntary turnover is much lower than you'd see in other places. But this is still a really hard job. It is emotionally hard. It is physically hard. And we get a lot of young people that this is something they try out earlier in their career, and sometimes they move on and do something else, and other times they stick with us, right? We have roughly about 15% of our organization that's been with us 10 or more years, and they all started as therapists. So there are certainly workforce challenges. There's more competition in the market for talent right now. And the biggest thing is, getting back to the incidence, we have 1 in 31 kids that are diagnosed with autism today. That's a lot of people that need access to care. And again, the best way that we're going to do that is to recruit the most talented and committed people into our field to be able to provide that care.
But it's tough to compete in the marketplace for just someone to go out and flip burgers and can maybe make an equal amount of pay. So I've always felt that to be in this kind of an industry, you have to feel it in your heart.
Yeah.
You want to help people, because that takes some of the money away.
Yeah, I think that's right. And with autism too, there's a range of within the workforce. So you have the highest level, which is like a Danny, which is like a PhD, board certified behavioral analyst, and then you have behavioral health techs. And so one of the things that we've done as a health plan is invested in different curriculums to support that training process. So we've invested a lot, for instance, in Pima Community College to create a whole health sector for training for the tech type level providers, which is more the paraprofessional level providers. But Arizona State and other universities within the state have really also invested in BCBA programs. And so we are starting to graduate more people in this workforce who are ready to come in and serve the population.
And I love what you said about it. You're looking to attract people with heart. I think one of the things that sort of draws people on autism, in addition to that, particularly if you have the heart, is that we have good outcomes are possible, right? So I used to tell people when I was a therapist, people would come to me all the time and say, "You must be so patient to work with kids with autism." And I'd say, "I'm like the least patient person you know." And this is why autism works for me, because I can pour my heart into these kids or these teens or these adults, and I'm going to see improvement and progress in them every day, every week, every month, every year. And if that wasn't the case, I think I would have lost interest a long time ago.
Well, given your different perspectives, what do high quality ABA services look like?
I'll start at the high level, and Danny, you can really dig in
Sure.
here. Individualized. Let's start with that, because what I've seen with our membership is sometimes we see kind of these cookie cutter treatment plans. So when you have autism, you really need a plan. What's the plan of attack for how we're going to manage the child or the adult's needs? And that is when you sit down with your support system, if you're a child with your parents, if you're an adult with whoever your support system is, and your provider, and you sit down and map out this treatment plan. And it's got to be specific to what your needs are. And then what are the milestones in that plan? What do they look like? If it's a child, like my goal is to get my child into kindergarten at X age and progress and do well in school and so on, and maybe try a sports team or an art program, or grow into those things that a typical kid might grow into. So those are all the kinds of things that are part of the treatment plan. And then if you start seeing, like Danny was talking about, I see the changes and I see the progression. If you're not seeing the changes and the progression, there's got to be an alteration in the plan. If after 6 months, 9 months, you're doing the same stuff over and over and you see no progress, there has to be then an update. A different modality needs to be tried with that individual, because the one that you're working with isn't resonating with that person. So that's sort of from the high level what we're looking for.
I think for us, the number one thing that I would tell you is that it needs to be fun. And I know that doesn't sound very scientific, but one of my mentors, Lynn Cagle, always used to say, if kids with autism aren't having fun, they're just not learning as well. And so ABA needs to be fun, right? And it needs to be engaging for kids, and they need to be enjoying it, or they're not going to learn as well. That's a huge one for me. The individualization, we've covered multiple different ways. But again, I'll remind you that ABA, by definition, should be highly individualized. And so if we're doing the same thing for all kids who we know are individually different, that's not a high-quality ABA program. There is something about the intensity of services, but again, it is not one amount of hours per week for every single kid. Those need to be individualized and based on medical necessity. I think another one is the place of service and where that's happening. We know that these are kids that have a tough time generalizing skills across settings. And so if we are only working with kids in one setting, in one place, and never working with them across settings, we don't have this quality of an ABA program. We focus a lot on getting kids not just in a clinic, but in their home, in their school, out in the community, in different places where other kids naturally are. And then a final one that I'll give you is about parents being actively involved in what's happening with their services. We've got lots of research supporting this. We have parents, by the way, who we teach to do our services, our ABA-based programs, and they're better than some of our therapists. So why would we not want to have them included in what we're doing? And you want to talk about intensity. The easiest way to get intensity is to have parents learn these skills so that they're implementing the same thing as the therapist through all of the child's waking hours.
That's covering a lot of ground right there. From your different perspectives, where do you see tension or disagreement when it comes to ABA services?
Yeah, I mean, I think Danny touched on it. I think one of the misconceptions is my child gets an autism diagnosis, they have to get X number of hours a week. It's got to be 40 hours a week, or it's not going to be efficacious. And that isn't the case every single time. It is the case for some children who may need intensive care, but it isn't the case for everybody. So back to that point of individualized services, you really just need to sit down to see where is your child at. And if you're if the response that you're getting from your provider is, well, no, it's a standard 40 hours, that's the standard. There isn't a standard like that. So that should be a red flag to you right away. If somebody also says, well, your child can't go to school, they just can't because they're going to need all these hours all the time, that should be another red flag, because that isn't how it works either. So I think, and it's really hard to know because we're just parents. We're not a Danny Openden with all these years of training and experience and degrees. We're walking in trying to get help for our child. And if somebody's telling me 40 hours a week is what's needed, I'm going to believe that. But that isn't always what's necessary.
I think for me, it goes back to what I said earlier about ABA is not a treatment for autism. It's a scientific approach for improving socially important behaviors. And under that are many different ABA types of therapies. And one of the things I see going on in lots of places right now is people thinking ABA looks like one thing applied to all kids. And that's a problem. At SARC, we specialize in an ABA-based therapy called pivotal response treatment, or PRT. It is a naturalistic, play-based form of ABA that has just as much, if not more, scientific evidence supporting it, and looks very different than a traditional ABA-based program. So I think some of the tension comes from we've gotten in our head because we just say ABA services that we mean one thing. We know ABA is supposed to be highly, highly individualized, but we also know that there are different types of ABA that might work differently for the different profile of kids that we're working for.
So if a family is listening today and they're just starting to navigate through an autism diagnosis, what's the one thing that each of you would want them to know?
Well, for me personally, I think that diagnosis is so overwhelming, and you just sort of feel like the weight of the world just crashed on your shoulders. It's very emotional, it's very difficult. And so I think the one thing that I would want families to know is there's help, and there is hope, and there's support. And if you as the parent need that support too, you better get it, because it is really, really hard to manage your life, your work, your day-to-day, your other children, and try to navigate everything that's going on with your child that has autism. So get the help for your child, but don't forget about yourself as well in that process.
You got to care for the caregiver.
Mm-hmm. Absolutely.
I think for me, I think we need there's a sense of urgency about don't wait. Whether it's a pediatrician that suggests something to you like, hey, there might be something going on here, or you have some sort of gut instinct. It doesn't hurt, even if it's just to rule it out. What we're seeing, I feel like we're seeing more since we did that study, we're seeing more and more like kids starting later and later. And that really concerns me because we're missing out on this critical window to make a big difference. And by the way, if we miss that window, it doesn't mean hope is lost. But we have the best outcomes when we start early. And I think what I would say to a parent that's navigating that autism diagnosis, if there is any concern, if you're just worried a little bit, seek out an evaluation, or at least a screening to tell you if you should seek out an evaluation. You don't want to wait. Even in that study that I mentioned earlier, where the screenings did happen, one of the unfortunate pieces of data we have from that study is roughly 50 to 60% of the families that were told that they screened with some concern about an evaluation, they should seek out an evaluation for free. 50 to 60% of those parents did not follow up and seek out the evaluation, didn't call us, and didn't respond to 3 calls from us to come in for that evaluation. We're just losing. And again, screening doesn't mean you have autism, but it might mean you have autism. And we can do a whole lot for people with autism when we start young. We've got to do better at getting both pediatricians and parents sort of following that level of urgency when there's any concern to seek out an evaluation. We have the best chances with a good early diagnosis and early intervention.
So where do you see the ABA services evolving over the next 5 years? Or maybe another way to ask is, where would you like them to go and evolve? How would you like to see them?
Well, I think that the big key thing from where I sit is moving away from this cookie cutter approach. I think for a lot of years that's sort of the program we followed is everybody gets the same box lunch, so to speak. And so as we grow, as we learn more, as we train clinicians better, build those curriculum better, that then those clinicians can be more responsive over time to see this modality that I'm working with, this particular patient is not working. We've got to pivot to do something differently. So that evolution, I think, is really important, because I think what we've seen is a lot of providers just default to a set group of services and use that same set over and over and over, and it's not efficacious for everybody.
I see three ways that there will evolve over the next 5 years. One goes back to that early identification, and that is, I think we can start to work with kids that are as young as 6 months of age that don't have a diagnosis yet, but maybe they have an older sibling with autism, or there are some concerns that might be there. We have a program called Milestones that follows those kids, and any kid that's showing any kind of deficits or red flags for autism, we pull into a one-to-one parent-parent training program. It's like starting early intervention. And those kids are either not ending up with a diagnosis, or they have started our services so early that they're far ahead of other 2 or 3 year olds kids by when they started. So I think early diagnosis and treatment. I think the full other side of that is what's happening with adults with autism. For a long time, we didn't pay attention to adults with autism, and yet we know children with autism are going to become adults with autism, and they're going to be adults way longer than they were kids. And these same ABA-based procedures are being used to teach employment skills, independent living skills, shopping skills, transportation skills. So I think that's another one. And then third, I think that ways that we can be able to use ABA to change the community around people with autism as well. This is a big focus for SARC. It's one of the reasons we love being in Mesa, because they're the first autism certified city, is that we want to build inclusive, supportive communities. We can use the same science of ABA to change the behaviors of the community and build a better, inclusive, supportive community, not just for people with autism, but for all of us.
So if you had one message that you could give to policymakers shaping the system, what would it be?
They have a role to play. And Danny was talking about the city, for instance. So cities and local municipalities absolutely play a big part in ensuring that we have autism-friendly cities, as well as our state legislature has a role to play in supporting investments in some of the programs that Danny was talking about, particularly for adults. We don't have housing and employment programs, broadly speaking. There are very few providers like SARC that are really invested in supporting those young people, especially as they age into that employment age categories. And SARC invests in working with those employers. So members of the Mesa Chamber, for example, there might be members of the Mesa Chamber who could be employers to individuals with autism. And providers like SARC do that specialized coaching for employers to create those opportunities and make sure they have a friendly workplace. But yeah, policymakers absolutely have a role to play, and I think there are key investments that they can be making going forward.
I would want policymakers to know that ABA is not one thing, that there are, like any other area, there are really good providers, and there's some bad actors out there as well, and don't throw the baby out with the bathwater, right? There's a lot of great providers doing really great work like SARC, but we're not the only ones. The other thing I would want them to know is, as I said earlier, there's a lot of hope in autism. And if we remove barriers to access to diagnosis and treatment, we got a population of people who are so responsive to really good treatment and intervention, they can go on to live really great lives and contribute back to their city and state as well. And a great example of that, just last year, we went to the legislature with a bill to update Stevens Law, which was the original autism insurance mandate, And what that did is remove the age and dollar caps from Stevens Law, which meant that you couldn't cap somebody just because they hit like some out-of-pocket maximum amount that they were spent. And more importantly, we removed the age. It used to stop at 16. Now there's recognition that adults need services too. There's no age caps there anymore too. So that's a good example of removing barriers so that we can really support this community.
So we're down to the kind of nitty gritty now. I have two more questions for you. The first one is, how can individuals and families continue to stay connected and advocate for a high quality mental and behavioral health system? And, that's kind of what Mental Health Awareness Month is all about. It's advocacy. It's talking about stop the stigma. It's getting out in front with all kinds of different programs that can help people. So that said, how would each of you advise on that?
Yeah, absolutely. There are so many incredible organizations out there. Let's take NAMI as one example. There's the statewide NAMI, National Alliance for Mental Illness, and then there's also local chapters for NAMI. And what's really awesome about those organizations is the peer voice. And that is the individual with lived experience who has critically important role to play in their own advocacy. What I see a lot down at the state legislature, for example, is we love our family members, we love our parents. That's very important. But parents can't always be speaking for their adult children. At some point, we also have to be willing to listen to the individual with the actual lived experience, because that voice should be the most important one in this conversation. And kudos to Danny too for bringing in a self-advocate group, advisory group as part of SARC. So there are also organizations like SARC on the autism side, the Autism Society. There's all kinds of associations and organizations for you to be a part of, to get more information and to have a role to play, both as a family member and also as a peer.
Monica took mine. We're really proud of this self-advocate advisory board group. I think, when we passed the original Stevens Law, for example, that doesn't happen without parents. I mean, parents were at the legislature telling their stories, but that was 18 years ago. And what we've learned now is that, we now have people with autism who can speak for themselves. And it's one of the things that we're really proud of, is that we meet with this group quarterly, and they advise us on our research, on our clinical services, on our marketing, and on our communications. And I will tell you, it is the single best part of my job today. Once a quarter, to come into this group to kind of put ourselves out there and say, what do you think? And we have walked away with some of the best insights just by asking people on the spectrum. I think if we go to the people that we're serving and trying to do good service for and ask them what we should be doing, we get really good feedback on what that ought to look like.
So last question for both of you. You both have obviously tremendous passion on this subject. Tell us what your final thoughts would be. Maybe even take it to if it were a perfect world, this is what I would want to see.
Yeah, if it were a perfect world, gosh. I mean, listen, I think my final message is there's help and there's hope. And I just know that we have, whether it's mental health, whether it's autism, there are a lot of families, a lot of individuals who are struggling with trying to manage that and trying to figure out, how am I going to get out of this dark place that I feel like I'm in? And I just want people to know, pick up the phone, call anybody. Even if you don't know who to call a friend, call your neighbor, and call the crisis line, call 988. But don't wait. I mean, Danny was talking about don't wait with autism. Don't wait with whatever it is that you're experiencing. And really what I hope that we drive towards is building these inclusive communities, that we think about healthcare differently, that we stop placing a stigma on accessing services, that we stop talking about people with mental health needs or with autism as a they, as some other kind of person, some other kind of entity. They're part of our communities. So how can we continue to drive that message home? Because I think, as Mesa has demonstrated, when you change the vocabulary, when you change the perspective and the mindset, then our communities open up. We look at things differently. As a chamber, perhaps, we start employing differently. We start preparing our workplaces differently. And that's just going to change everything in the long term, because what we ultimately want is all of us as individual human beings is to live to our greatest capacity, to live independently to the greatest extent, and to feel like we're a contributing member of society.
Absolutely.
I think for my, it's one of the things I love is Monica kept using the word hope, and we just completed our signature event. It's an annual community breakfast. It was attended by over 1,500 people from our community just a few weeks ago, and the theme of this year's breakfast was "Hope Happens Here." And I think we try to help people understand that we don't define children, teens, and adults with autism by what they can't do today. Rather, we ask what's possible tomorrow with the right support, the right plan, and the right people. And that's what happens at SARC. It's what happens in this community. It's what happens around this city and Mesa. And soon it's what's going to happen across this entire state. And we firmly believe that hope happens here, and we see it as our responsibility to partner with cities like Mesa and all across the state to make sure that hope happens everywhere.
This has been a great pleasure. I can't thank you enough for what you're doing for the community. And thanks again to the Mesa Chamber of Commerce for giving us this wonderful platform. So, Monica, Daniel, thanks again. And that's about it for today.
Thank you, Jeff.
Thank you. Appreciate it.
Really appreciate it.
This has been a Mesa Chamber of Commerce Inside Business podcast. You can find all podcast episodes at iTunes, Spotify, or your own favorite podcast website. You can also find them online at mesachamber.org. Content of this podcast is copyright the Mesa Chamber of Commerce, unless otherwise noted.